About 2 in 1,000 patients in the United States are on dialysis, which means these people have end-stage renal disease. You absolutely need your kidneys to filter blood. That is its main function, one of the many functions. Simply put, the kidneys are essential for filtering blood and recycling all the toxins and returning it back to the blood. It's so important to know the statistics because about 2 in 1,000 patients in the United States are on dialysis, which means these people have end-stage renal disease. You absolutely need your kidneys to filter blood. That is its main function, one of the many functions. Once the kidneys stop functioning and you need hemodialysis, most people either are on peritoneal dialysis, hemodialysis, or they have a kidney transplant. So let's talk about hemodialysis access options. Tunnel dialysis catheter placed through one of your chest veins, not a very good long-term solution. In fact, increased risk of catheter infections, blood clots developing. Basically, you want to take it out as soon as possible. The other option is peritoneal dialysis. One of the main benefits is you're able to do this at home, but now there are many dialysis and renal centers that allow people to be trained to do hemodialysis at home. Hemodialysis allows for filtering of the blood and returning it back after it passes through the filter to the body. For that, you need a conduit, whether it's a fistula or a graft. Let's talk about the two differences between fistulas and grafts. So recently I performed brachiocephalic arteriovenous fistula. It's a connection between the outer vein that runs in the arm connected to main arm artery. There are two veins that can be used if they're adequate in caliber and size for use for hemodialysis access creation. The other option is a graft. The fistula is preferred over the graft because grafts tend to have a higher infection risk and also a higher risk for thrombosis or developing clots, which requires revisions of the graft. And also, maintenance procedures tend to be more prevalent in those people who have grafts. However, I have seen patients have sustainable grafts and fistulas for many years. In fact, I saw a patient in clinic today who had a previous graft that lasted him 10 years. So it's truly a viable option. The most common risk factors for chronic kidney disease are high blood pressure and diabetes. If you have diabetes or high blood pressure, it is so critical to make sure you have the proper maintenance and surveillance of these comorbidities, as they both tend to progressively worsen chronic kidney disease if not taken care of.